Okay, thank you very much. Before we start with the agenda, please let me inform you the rules of this webinar. First, the webinar is live streamed through Simio Racfon YouTube channel. And for participants who have joined us from Zoom platform, please adjust your username with the following format: name_institution. Please adjust your username with the following format: name_institution. During our Q&A session, participants may ask questions by filling out the Google form through following link. As you can see on the screen, at the end of the session, participants are expected to fill in an evaluation form as a proof of attendance. And then the certificates will be given to the participants who completed the evaluation form. The link to the evaluation form will be shared at the end of the session. The certificates will be available 3 weeks after this forum. For further information, please visit Simio Racfon's website and social media regularly. Be sure to subscribe and like Simio Racfon's YouTube channel and follow our other social media accounts as well. Ladies and gentlemen, let's start this webinar. Assalamualaikum warahmatullahi wabarakatuh. To all distinguished guests, Director of Simio's Secretariat, represented by Dr. Kamal, and Board of Directors, Managers, and experts of Simio Racfon, all distinguished resource persons, all respectable participants, sir, madam, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon you. A very good morning from Jakarta. Welcome to the Regional Learning Exchange on School-Based Nutrition Promotion. My name is Nindita, a Simio Racfon staff, and I'm honored to be your Masters of Ceremony for today's event. We would like to inform you that this event is live streamed on our YouTube channel, Simio Racfon. So a very welcome to our participants who have joined us on our YouTube channel as well. Today, Simio Racfon and the Southeast Asian School-Based Nutrition Promotion SBNP Working Group are conducting a virtual regional learning exchange on SBNP to share best practices and critical success factors from their respective countries. Let me give a brief introduction of Simio Racfon before we proceed further. Simio Racfon is one of the 26 specialist centers of the Southeast Asian Ministers of Education Organizations, or SIMIO. Our center envisions to become the center of excellence for building capacities in food and nutrition of all people in Southeast Asia. We are now operating under our third 5-year development plan, which aims to undertake multi-sectoral and inclusive nutrition development for uplifting the lives of our stakeholders through our research, training, community development, information exchange, and partnership mandates. Before we proceed with our main agenda, we would like to invite you to gain more understanding of our organization by watching the Simio Colors and Simio song. The committee will help us to play the video.
It's time to open our eyes to a bright and promising future. We'll rise to the call of the times and create a stronger tomorrow. Let's start to make a difference, teaching everyone to learn through science, health, and technology. We will share our expertise by promoting knowledge and policies. We can build a better world. Let us take a stand for our visions alone, making future plans for the people to grow in a life filled with happiness and green. Here at Symbion, building the future is our legacy. We'll achieve our goals through partnership, creating opportunities. By working hand in hand, we can accomplish all our dreams. For a better quality of life is now within our reach. Let us take a stand for our visions alone, making future plans for the people to grow in a life filled with happiness and green. Here at Symbion, building the future is our legacy. Let us take a stand for our visions alone, making future plans for the people to grow in a life filled with happiness and green. Here at Symbion, building the future is our legacy. Building the future is our legacy. At
Indeed, building the future is our legacy. Ladies and gentlemen, to welcome you all, we would like to invite Director of Simeo RecFon that will be represented by Simeo RecFon's Deputy Director for Program, Dr. Jesus C. Fernandez, to give his welcoming remarks. Please welcome Dr. Jess Fernandez.
Okay, thank you very much, Patita. Good morning, ladies and gentlemen. On behalf of our director, I would like to give or read his speech as a welcome address for this forum. So once again, good morning to everyone. It is my pleasure and privilege to welcome you all to this first Regional Learning Exchange Forum on School-Based Nutrition Promotion as part of our center's flagship program on Nutrition Goes to School, or NGTS in short. I would like to believe that your presence in this forum indicates how important you consider the role of schools in improving the nutritional status of our school children and adolescents. Our NGTS program is one of our center's interventions to realize our lifespan approach in addressing the food and nutrition issues and concerns of our stakeholders, which in this case, our target for NGTS are the school-aged children and adolescents. As a school-based and multi-sectoral intervention, the NGTS program aims at improving students' learning outcomes and active participation in school activities by practicing proper nutrition habits. To support the NGTS program, ladies and gentlemen, our center's governing board has approved our proposal to form the Southeast Asian School-Based Nutrition Promotion, or SBNP working group in 2018 and formalized its establishment in a workshop conducted in 2019. The working group is envisioned to carry out 4 major activities, namely compiling best practices and evidences on the impacts of nutrition promotion activities in school. Second, compiling nutrition promotion materials or media that have been used by schools and other government agencies. Third, conducting advocacies to integrate nutrition promotion activities in regular school routines. And last but not the least is to initiate standardization for capacity building of teachers to deliver nutrition messages at school. We are proud to tell you that the SBNP working group has been approved by the SIMU Council to be scaled up in Southeast Asia during its 50th meeting, 51st meeting in 2021. Ladies and gentlemen, as part of the Southeast Asian SBNP working group plan of activities for 2020-2022, SIMU RecFon facilitated the publication of school-based nutrition promotion country profiles in collaboration with ministries of education of SIMU member countries. The first batch of country profiles formulated are on Indonesia, Thailand, Laos PDR, the Philippines, and Brunei Darussalam, as you have seen in the video earlier on. Its country profile contains, among others, information on the nutritional status and dietary related practices of school children, SBNP policies and programs, and the extent of their implementation, as well as best practices and challenges in implementing SBNP in its SIMU member country. We expect that the first batch of SBNP country profiles will be available for dissemination during the first quarter of 2023, and we are still waiting for the official endorsement from the ministries of education of the said countries. Ladies and gentlemen, from the country profiles, we learned that most, if not all, governments in Southeast Asia have specific or related policies mandating the implementation of SBNP programs at various school levels to their respective or in their respective countries. However, their experiences, particularly the best practices and key success factors, have yet to be shared to foster a more regional scaling up of SBNP program implementation in our region. Thus, the SIMU RecFon, together with the Southeast Asian School-Based Nutrition Promotion Working Group, agreed to conduct a virtual regional learning exchange forum on SBNP to help realize this purpose. The objective of this virtual learning exchange is to share policies, strategies, and best practices on SBNP program implementation in Southeast Asia towards building a healthy and nutritious eating habits among school children and adolescents. We would like to express our gratefulness to the following: to the SIMU Secretariat Director, or the Secretariat in general, which is now being represented by Dr. Kamal, to officially open the forum, to Ms. Laila Tul from the Ministry of Education of Indonesia, who will share about the implementation of the UKS into classroom activities on the Healthy School program in Indonesia. Ms. Siti Adiba binti Abdul Halim from the Ministry of Health of Malaysia, who will discuss about the roles of nutritionists, local government nutritionists, in promoting healthy eating habits among school children in Malaysia. Mr. Ruel Capistrano from the Department of Education of the Philippines, who will acquaint us on improving the health and nutrition lifestyle of school-aged children and adolescents in the Philippines through the technology livelihood education subject, and Dr. Irene Rosita from UNICEF Indonesia, who will enlighten us on the best practices on implementing and monitoring school-based nutrition promotion program in Indonesia and perhaps elsewhere in Southeast Asia. And last but not the least, I would like to express my appreciation to our team from RecFon for preparing the scoping review on the different strategies for nutrition education at school setting in Southeast Asia, which will be presented by Dr. Helda later on. Once again, ladies and gentlemen, I welcome you all to this forum. I wish you a great learning experience in this forum. We hope that the knowledge that you will gain from this forum will further be shared to your colleagues and could be implemented in your respective work settings. I appreciate the hard work of the Forum Organizing Committee and the support from the Ministry of Education and Culture, Research and Technology of Indonesia for making this forum possible today. I wish you all fruitful discussion for the forum, and we hope that we will have a collaboration in the future to really establish and institutionalize SBNP in our region. Thank you very much, and once again, good morning. Back to you, Tita.
Thank you very much, Pa Jess, for your remarks. So, ladies and gentlemen, we are still now expecting Dr. Kamal, a program officer for research evaluation, who will represent Director of SIMIO's Secretariat, to deliver his opening remarks. But he still haven't joined us on Zoom, so we will be inviting him again later on when he attends. Ladies and gentlemen, before we're moving forward to our next agenda, I would like to kindly invite all participants to please activate your camera for a photo session. So there will be a few slides for this, and the cue will be on me, so I would count to 3. Please, committee, would you care to help for taking a picture? Okay, I would count to 3. Please put on your brightest smile. 1, 2, 3. Okay, we will do the next slide. 1, 2, 3. Okay, I'm gonna give one more chance for the committee to take one slide. 1, 2, 3. Thank you very much. Thank you very much. You may deactivate your camera, or you can activate it as well until the end of the session. Ladies and gentlemen, thank you very much for your participation. To turn off your camera. I hope our participants are getting more excited as we are now coming to our next agenda. We will now have a series of presentations from our distinguished resource persons, and this session will be led by SIMIO RecFon's Knowledge Management and Policy Support Unit Manager, Ahmad Thohir Hidayat, M Nutrition. Ahmad Thohir Hidayat, M Nutrition, is a junior researcher at SIMIO RecFon based in Jakarta. He graduated from Diponegoro University in 2014 and obtained his master's degree in community nutrition from Universitas Indonesia back in 2017. He serves as a team that conducts evaluation of multi-component behavioral determinants of health in adolescents using a web-based application for Indonesian side in collaboration with National University of Singapore. He is also part of a team that conduct evaluation of children intake with Down syndrome and ADHD, and also has responsibility as manager of knowledge management and policy support unit in SIMIO RecFon. Ladies and gentlemen, without further ado, please welcome our moderator, Ahmad Thohir.
Thank you for your kind introduction, Tita. So, good morning, ladies and gentlemen. I am Tahir. I am as a moderator. Welcome you all to the Regional Learning Exchange on School-Based Nutrition Promotion. So, as Mr. Just said just now, that this virtual learning exchange aims to share policies, strategies, and best practices on SBNP program implementation in Southeast Asia toward building healthy and nutritious eating habits among school children and adolescents. So, for today's webinar, there will be 5 speakers, and we'll talk about various aspects of SBNP implementation. And before we start for the presentation of the speakers, if you have any question, you can fill the Google form link that will be shared in the chat box. And however, please ensure that your question is brief and clear. And also don't forget to choose the to whom your question is directed. So without further ado, let's start with our first speaker. Our first speaker is Halda Hussein, MSc PhD from Senior F1. Mrs. Halda Hussein is an expert at the Senior Regional Center for Food and Nutrition. She holds a bachelor's degree in food technology and nutrition from IPB University, and a master's degree in community nutrition from the Universitas of Indonesia, and a doctorate in public health nutrition from the University of Queensland. She is also the head of community nutrition major at the Universitas Indonesia, the coordinator for the school-based nutrition promotion working group, SBNP, and a lecturer at the Faculty of Health Science, Universitas Muhammadiyah, Professor Dr. Hamka. She is also the lead consultant for the Indonesian nutrition sector review. So, with all due respect, please welcome Dr. Halda.
Okay. Thank you, Tohir, for the kind introduction. So allow me to share my screen first. Is my screen visible?
Yes.
Okay. Bismillahirrahmanirrahim. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Thank you for the opportunity to present this review. So as an opening to this first learning exchange forum, a team from Senior Fund conducted a scoping review on strategies for nutrition education at school setting to provide a context of what research has been done in this field. The team consisted of Dr. Luh Ade Ariwiratnyani and Nurulita Aida Rahmasari and myself. And we give title to the presentation, Nutrition Education at School Setting, Lesson Learned from Research Findings. So this is going to be the outline for the presentation. Okay, before starting with the review, we will start by drawing attention to the fact that children and adolescents has a significant proportion in the population structure of the Southeast Asia region. 33.9% of total population of ASEAN countries were aged 5 to 19 years. And the proportion was highest in Laos PDR and the Philippines and lowest in Singapore and Thailand. So we cannot afford to leave this age group behind in the improvement of nutrition situation. In terms of burden of disease among children and adolescents, so we have the information for the 4 to 15 years in Southeast Asia. In Southeast Asian countries, around 55% of total burden of disability-adjusted life years were attributed to non-communicable diseases, but communicable diseases was still significant contributor as well to DALYs as well as injuries. If we have data for 5 to 19 years, it is believed that the attribution of non-communicable diseases toward disability-adjusted life years will be higher. The proportion of non-communicable disease as cause of dialysis has been increasing, as can be seen in the next slide. So in this slide, we see the shifting of cause of disability adjusted life years from 1990 to 2019, which showed that in 2019, non-communicable diseases ranked higher than their ranks in 1990, while the communicable diseases reduced in ranks. In 2019, top 5 causes of dialysis were mental health injuries, including road injuries and drowning, skin disease, and other non-communicable diseases and enteric infection. The burden of diseases were also reflected in the prevalence of risk factors. This figure is developed from data from 140 countries. This is a publication from Lancet. This box and whiskers plot showed the distribution of the prevalence by countries, with the mean shown by the bar in the box, here. It showed that insufficient vegetable intakes has the highest mean of prevalence, mean the most problem here, and then also followed by here physical activity and insufficient fruit intake, as well as sedentary behavior. So nutrition and physical activity is problematic among adolescents. The pattern is no surprise, as the case has been also found in studies from individual countries. Okay. Furthermore, we can also see that the prevalence of the risk factors increasing over the years, so that in recent years, the median prevalence of having 4 NCD risk factors in Southeast Asia, this one, is around 40%. So 40% of adolescents in Southeast Asia, this is the mean prevalence, yeah, in Southeast Asia have 4 or more NCD risk factors. So considering the increasing health and nutrition problems among adolescents, appropriate and timely intervention to promote healthy lifestyle among adolescents is a must. Investing in this age group is beneficial for their current performance in school and their community, as well as the health of the future generation. So the reviews have shown that school-based, home-based, and clinic-based solutions have been suggested as possible viable strategies, among which school-based intervention is believed to produce a massive effect. But the question remains whether school-based intervention exert significant impact on the nutrition and well-being of adolescents, especially in Southeast Asia. Therefore, we conduct this review to explore research conducted to assess effectiveness of nutrition education at school, to improve knowledge and practice, and to identify lessons learned for program. So this is the review method that has been conducted. We conduct the review on PubMed and Google Scholar with using a predefined search terms and filters. From initial search retrieved 225 records, and after several screenings, we are left with 19 studies which were included in the full text review. Okay, from the review, we understand that the studies come from Indonesia, Malaysia, Philippines, and Thailand. The type of the study is quasi-experimental, crossover study, and randomized control trial. And the platform that is used for nutrition education, using intracurricular, special session, or using a platform which is available at school, like school canteen, school feeding, school garden, and also using online mobile application. And basically the intervention consisted with nutrition education with various strategies, and food intervention also with various strategies. Okay, so we will look at the type of intervention one by one. For the nutrition education, we learned that from this review, we learned that nutrition education was targeted sometimes toward all children, sometimes mostly more on overweight or obese children. And the activity was different by different class level. For example, for elementary school, games are used as media for nutrition education, as well as developing habits through group practices. While for junior high school and high school, mobile application and individual counseling are used as media for nutrition education. The intervention duration ranged from 1 week to 7 weeks, but there was a study with much longer duration, which lasted with follow-ups lasted until 15 months. The topics covered for nutrition education also varies from a very specific topics to more general topics. And the nutrition education activities were conducted within school agenda or outside the school agenda, for example, during weekend. And also in some settings, not only school-based, but also completed with family-based intervention involving parents. The strategy for nutrition education also varied. The first strategy is information dissemination only, using group session with media and also with individual counseling. For this type of strategy, the measured outcome mostly knowledge and attitude. And then the second strategy was giving information dissemination with experiential learning, like rising fish at school, breakfast together at school, student-led nutrition competition, or daily eating of whole grain food. That was the activities that we able to identify during the review. For this type of nutrition education, the outcome measured were knowledge, attitude, and practice, as well as dietary intake in general and specific, and practice of physical activity and nutritional status. And then the third strategy is information dissemination with a healthy environment strengthening, including strengthening of the school canteen, capacity building of street food vendors, provision of water and sanitation facilities, and also capacity building for parents. For the intention is to build a healthier home food environment. So the measured outcome for this type of nutrition education is more on practice, eating behavior, and then also physical, more on behavior outcomes, yeah, eating behavior, physical activity, personal hygiene, and also food safety behavior. And what do we learn from the studies? From the information from research using information dissemination only for nutrition education, there is an increased knowledge post-intervention and at follow-up, but no changes on attitude. Yeah. When information dissemination was combined with experiential learning, there is some changes in the practice, like reduce skipping meal habit, choosing healthier snacks during morning recess times, and also had higher physical activity and better cognitive performance. And also there is increased diet quality in general among intervention group, and significant increase of knowledge, attitude, and practice for some indicators. Yeah. Similar to the information dissemination plus healthy environment strengthening, there is also changes in practice post-intervention and also during follow-up. So adding more to the information dissemination only is beneficial. Some notes on the nutrition education. We identify that for subjects who have relatively good knowledge and attitude at the baseline, there is no significant improvement in knowledge and attitude. And despite the reduction of consumption of unhealthy foods, which is one of the outcome measure for the second strategy of nutrition education, the consumption remains high. So it's still a problem. Yeah. And then the improved practice were no longer observed after 6 months of follow-up. This is partly due to lack of parents' involvement and decreased adherence to treatment over time. But we also have to be aware that some studies were done during COVID-19 pandemic that may influence the result on children's dietary intake and physical activity. And the lesson learned from research on nutrition education is that selection of learning education media is important. Yeah, so the suggested media should be based on the characteristic of the main target, and then should include tools that may simplify complex concepts and trigger more senses, like using audio visual kinetics is actually resulted in better learning. And then also tools that enable students to discuss his or her own knowledge and attitude toward others. And then also tools that create repetition on nutrition messages, which increase the children's memory. And then also for overweight and obese children, apparently individual counseling is more advisable than group counseling. And then the self-reported dietary practice by children seem to be acceptable. So some studies use self-reported dietary practices, yet under and over-reporting intake should be analyzed. Analyze should be done. Yeah, and then we understand that in some studies there is loss to follow-up 10 to 15%. So this need to be considered when a program is going to be conducted on this aspect. Okay, and then the poster placement only is less effective for nutrition education. And then to build skills and confidence, the agency of the student to conduct to do to change the behavior, the practice, they also need experiential learning, which is practices group practices together. Yeah, so that was the lesson learned from the nutrition education. The next is school feeding. There are some the studies were actually regarding the national scale school feeding programs. Yeah, the objective of the school feedings in all studies cover nutrition and health aspect, education aspect, and community education and economic aspect. And the national scale school feeding programs, the types is some is government funded. But there are also parents funded, like in Malaysia, using healthy breakfast sold in school canteen. So this is voluntary, and parents pay for that. Yeah, and the target is for government funded programs is more on undernourished children or children living in food insecure area. While for the parent funded or voluntary is also voluntary. The target is voluntary. The feeding days range from 90 to 190 per year, and meal preparation were conducted by some by cooking teams involving parents, some by trained school canteen operator, and some by hiring of cooks. And the menu in all school feeding program prepared by nutritionists or from the district health office with 6 cycle menu. Yeah, and some were considering the local food sources or vegetables from the school garden. And during the school feeding programs, additional activities including nutrition education and character building is also included. This is some of the examples of picture from the school feeding programs in different countries, from Malaysia, from Indonesia, as well as from the Philippines. The outcome of the school feeding program on nutrition aspect, we see there is an increase in energy, protein, and micronutrient intake, increased consumption of diverse foods, reduced prevalence of underweight and wasting, and majority of the undernourished student beneficiaries convert to normal nutrition status. And then on education aspect, there is an increase in school attendance, improved learning experience, and then also, but for academic performance, it is hard to measure. For the character building aspect, children finish the foods, clean the table, feel grateful for the foods, queuing and socialize with friends and eating together. That was also one of the outcome measured during the school feeding program, and it is similar in many situations actually. And then community economic and knowledge aspect. This actually needs more evaluation on the effect of this program toward this aspect. Okay, and then the school feeding program apparently has achieved more than feeding the children. So it gave value to various aspects. And for the school feeding programs to be successful, good coordination across level is important. However, targeting still remains a challenge. There are still mistargeting. And then in the school feeding program, intensive resources were spent on the feeding and the activity or the budget reporting, but less about the nutrition education. So it needs to be strengthened. And the evaluation for demonstrating and generating evidence of the program should be done to evaluate the effectiveness. We are lacking in the evaluation to evaluate the effectiveness of the program. And then also some of key success factors for the national school feeding programs is there should be orientation of all stakeholders. Okay, and then this is part of the school feeding program actually. So this is a study on the double-blind cluster randomized placebo control trial using rice, which is used for a school meal program. The rice is a fortified rice, yeah. So provision of multiple micronutrient fortified rice in school meal program had a significant and positive impact on serum zinc and folate concentration among students in the fortified groups than the placebo. So there is a potential for this. Okay. So the conclusion from the review is that we see that nutrition education has, from the research, we see that nutrition education has shown positive outcome in terms of knowledge, attitudes, and practice of school children. But some intervention did not result in the expected changes as well, especially in practice. But the observed changes were not necessarily sustained during the follow-up assessment. So healthy practices need to be reinforced periodically, apparently. Yeah. And then adoption of healthier diet and favorable attitudes of the children may require support from environment, including policies on healthy foods at school, and as well as healthier food environment at home. And the proven effective nutrition education, school garden, and school canteen strengthening should be incorporated into the school feeding program to reach beyond nutrient intake indicator as well as for sustainability. So the school garden, school canteen strengthening, and nutrition education has shown improvement, has shown success during research, and we suggest that it should be incorporated into the school feeding program as well. And experiential learning apparently is better, reach better outcomes. And then we also suggest that a package of interventions rather than single aspect intervention is necessary, including the use of behavior change framework as a reference and involvement of all school communities, especially school principal. And integrating nutrition education into curriculum delivered by teacher or school staff is suggested as an effective delivery platform to give regular and reliable information for students. And school feeding program is also suggested not only to focus on undernutrition, but also start to focus on hidden hunger and obesity. And last but not least, the use of peer-to-peer approaches in health promotion intervention is show great potential to to improve certain behaviors among adolescents. So that was the conclusion and recommendation we have from the review. So thank you very much for your attention. We would like also to show the references for this for this review, scoping review, and also we provide the tabular mapping of scoping review result in the PowerPoint that we will distribute it. We will give to the committee. So thank you very much for your kind attention. I will give back to Tohir. Thank you.
Thank you very much, Muhalda. So, as we have mentioned, the nutrition education at school has potential to improve school children's nutrition practice. Even though based on the review, some part can be said sustainable yet, but it's okay because combining nutrition education, school feeding, and food fortification might result in better nutrition practices and status of school-age children. And let's continue to our second speaker. Our second speaker is Ms. Raila Mahfudatin from the Ministry of Education, Culture, Research, and Technology, Republic of Indonesia. She is an analyst of planning and evaluation at the Republic of Indonesia Ministry of Education, Culture, Research, and Technology. She was a pioneer for the Media Center Directorate of Primary Schools, a planner for the Primary School Directorate Programs, and a member of the drafting team for the Directorate of Primary School Strategic Plan 2020 and 2024. She graduated from the University of Gloucestershire with a Master of Education. So without further ado, with all due respect, please welcome she here.
Yeah, I'm here, Mr. Tohir. Thank you so much. You just can call me Laila.
Okay, please welcome Ms. Laila.
Okay, good morning, everyone. I'm Laila from Directorate of Primary Education, the Ministry of Education, Culture, Research, and Technology, Republic of Indonesia. First of all, I'd like to inform you that my director, Mr. Muhammad Hasbi, left greetings and apologize for being unable to attend to be speaker in this forum. We'd like to express our highest appreciation to Senior Rekfon, who has given us the opportunity to share experience on healthy school program in Indonesia. And later we can also learn best practice from other countries. Could the committee help me to share the screen, please? Okay, we can go to the next slide. Yeah, in Indonesia, we have Trias UKS. Trias UKS means that there are three main programs in developing healthy school in Indonesia. Firstly is health education. Health education is a fundamental part on overall school health program because health education provides students with knowledge and skill to become successful learner as well as healthy and smart. So the underline here is improved knowledge, attitude, behavior, and skill. Second is health services. No, we can, back this one. Okay, second is health services. We focus on providing students with health and then first aid and other health services to address healthy eating, physical activity, and prevent or cure disease. So in Indonesia, Healthy School program is a collaboration among four ministries, which are the Ministry of Education, Ministry of Religion, Ministry of Health, and Ministry of Home Affairs. And for health services are more supported by the Ministry of Health. Third is healthy school environments. So school are an ideal place for a student to learn about and practice unhealthy behavior. That's why school should be able to have students to be safe, healthy, challenge, support, and engage. In this third Trias UKS, is it an opportunity to school in creating a pleasant and sustainable school. Okay, next slide. There are some details of health education, for example, health literacy, where school usually have some strategies to educate students about health, either through discussions, making project-based learning, or other interactive activities to deliver key health message. Some schools also collaborate with public health center to organize socialization and education to parents. And for hygiene behavior change program, it is habituation of clean living behaviors, such as maintain personal hygiene. And nutrition education, it is not just learning about food and nutrients, but also learning what to do and how to act to improve nutrition of students. An optimization of physical activity is aimed to support the achievement of optimal growth and development, how students can keep fit and energetic, such as habituation of conducting ice breaking at the turn of class hour, and also optimize extracurricular activities in school like sport. And health agent in primary school, we call it dokter kecil or literary doctor, who become advocates for their peers to campaign health education. Next. And along an example of nutritional literacy schedule and topic. So, for example, in week 1 in January, school have topic about hygiene behavior. There is also immunization and other topic. Okay, we can go to the next slide. Yeah, in Indonesia, we have 3 option curriculum in learning recovery. First is curriculum 2013, which is thematic curriculum. We also have curriculum darurat or emergency curriculum, where during the pandemic, number of learning hours is reduced, perhaps around 2 to 3 hours per day. So school should pick most substantial subject to be taught. And the newest curriculum we have is curriculum Merdeka, where emancipated learning can be applied either for student or for teacher. So learning is more enjoyable, simple, in-depth, but meaningful. But I'd like to underline here that health education can be applied regardless of the type of the curriculum. Next. Yeah, the second pillar is health services. We know that student health is critical to their success and well-being at school. That's why we try to identify, screening, and taking into account of health problem, how we can ensure that students should be able to concentrate on learning. And usually for health screening is carried out by teachers, parents, or public health center. And the second example of health services is first aid. Actually, this is our homework for school or for central government, because not all schools in Indonesia have facilities and knowledge to handle first aid in school, especially in primary school. And regarding immunization, within a year, there are twice the implementation of immunization at school, which is in August and November. And currently, we are campaigning for school child immunization month. Okay, next. Okay, this is the schedule of immunization. We can see here that in grade 1 or class 1, student will be given measles and rubella vaccine. And for grade 5, they are given the human papillomavirus or HPV vaccine, doses 1. And for grade 6, they also have HPV vaccine for grade 2. So the Ministry of Education collaborate with the Ministry of Health to implement the immunization in school. Okay, next. Yeah, this is the third pillar of Trias UKS, so healthy school environment. There are many activities in school, such as creating green school, managing healthy school canteens, improving water sanitation and hygiene, handling waste management, and actualizing safe and inclusive school environment. As I mentioned earlier, the goal is creating a pleasant and sustainable school. Next. This is the example of application of green school in primary school in Indonesia, where they are an educational garden in the schoolyard, then also activity, food growing activity in school. As we know that many benefit of food growing activities, including increased healthy fruit and vegetable consumption, encourage care for the environment, foster a sense of responsibility, and connect kids with one another. Okay, next. Yeah, this example we got from Saga 6, Tangerang City in Indonesia, where they have program, it's called Kurasaki, or Kurangi Sampah Kita. In English is reduce our trash. So they try to eliminate plastic or bottle or other trash in school during meeting or during other activities. Then also we have EcoBrick from Purwakarta, where the bottle and plastic waste are turned into a chair. Okay, next. Yeah, the Indonesian government has several programs to support the realization of healthy school, including Adiwiyata School Program, Healthy School Competition, Healthy School Campaign, and Aksi Bergizi, or a Nutrition Awareness Campaign. Adiwiyata School Program is collaboration between the Ministry of Environment and the Ministry of Education to promote environmental education through developing an environmentally friendly green school program. And I'd like to share you about Healthy School campaign that we did currently. The next slide, please. Yeah, the Healthy School campaign was conducted in August 23rd, and Minister of Education explained the importance of addressing issues that still exist in our children, such as obesity, malnutrition, anemia. So the focus of campaign has three things. I will tell you later. So here we have jingle of Healthy School. We also have video during the campaign. Okay, next slide. Yeah, the goal of Healthy School campaign is to manifest healthy, strong, and smart children. There are three focus of the campaign. First is healthy nutrition, and then second is physically fit, and the last is fully immune. So these three points we try to campaign start from August 2022, and then if we already address it, we can continue to other point or focus. Okay, next. Next slide. Okay. So in terms of Healthy School campaign, we realized that school not be able to run optimally without the support all parties. Therefore, the Ministry of Education opens up as many opportunities as possible for all parties to collaborate with each other in implementing Healthy School. For example, for primary school or other level, they can reactivation of Trias UKS and identify what exactly collaboration opportunity with partner. And for partner, they can support program implementation through various collaboration. They can collaborate with school directly or with local government or with central government. And for parent, health awareness and habit in the family environment is needed. Okay, I think that's all. Thank you so much for your time and attention. I hope this presentation has given us new insight the implementation of Healthy School. Thank you, and I will return it to Mr. Tohir.
Thank you, Ms. Laila. So this from Ms. Laila about the implementation of health school in Indonesia, the implementation of Trias UKS into class activities into healthy school program, and also there is from Ms. Laila, we know that Trias UKS cover almost every part that is needed for the nutrition and health education at school, which are include the health education, health services, and healthy school environment. And success application of Trias UKS has many benefits for students and school community. And Indonesian government also has several initiatives for improving children health. One of them is that is currently currently working. So there is a healthy school campaign that aim to manifest healthy, strong, and smart children through healthy nutrition, physical fit, and fully immune. And collaboration through various sectors could give a massive help for the implementation of the healthy school campaign. So let's move to the next speaker. Our next speaker is Mrs. Irene Rosita from the UNICEF Indonesia. So Mrs. Irene Rosita is currently a nutrition specialist and manager for maternal, school-age children and adolescents nutrition program in UNICEF Indonesia. She has 20 years of experience in maternal and child nutrition, including program management, research, and teaching. Her past research and publication were especially on infant and young child feeding practices, qualitative studies on nutrition, management of acute malnutrition, and adolescent nutrition. In the field of adolescent nutrition, she has more than 20 publications in various forms, including articles in international peer-reviewed journals, policy briefs, magazines, training models, program documentation, guidelines, and strategies. She has obtained a doctoral degree of nutrition from the University of Queensland, Australia. So without further ado, with all due respect, please welcome Mrs. Irene Rosita.
Okay, good morning. Thank you, Mr. Tohir, for the introduction. Can you hear my voice clearly?
Yes, we can.
Okay, thank you. So let me share the presentation. Can you see the PPT now? Okay.
Yes, we can see it.
Yes, okay, let me, as being introduced by Tohir, my name is Irene Rosita. I'm a nutrition specialist in UNICEF Indonesia country office. I'm currently the program manager for school-age children, adolescent, and maternal nutrition for UNICEF. So I would like to share with you UNICEF experience in addressing the triple burden of malnutrition among adolescents. This is a program which has been implemented by UNICEF actually since 2016 and currently has been scaled up to become a national program and also a national movement. So I'm sure many of you are actually aware of the situation of adolescents in Indonesia. I understand that the audience are actually coming from the region. So let me introduce a bit about the proportion or the social characteristic of adolescents in Indonesia. Currently, we have more than 45 million of adolescents, which is comprising almost 1/5 of the total population. So if we look at the proportion of married adolescents, Indonesia is still a country which has many girls becoming a bride at the age of below 18. So you can see here, especially in the rural area, 1 in 9 girls actually married before the age of 18, which is very much different compared to the situation in urban areas. So Indonesia is also a prime example of a triple burden of malnutrition. So what is triple burden of malnutrition? I'm sure you are all aware that triple burden of malnutrition consisting of undernutrition, overnutrition, and also micronutrient deficiency. So adolescents in Indonesia actually experience those 3 nutritional problems. The data in 2018, with this, the latest national data shows that actually still around 1/4 of adolescents, both boys and girls, suffering from stunting, and also around 10% suffering from thinness. But also you can see here that there has been quite a high rate among adolescents in Indonesia, both at the younger age, 13 to 15 and 16 to 80 years old, who actually started to get overweight and obese. We also experience anemia among our adolescents, and also, primary school children. If you look at the data from age 5 to 14, 1/4 of our children are actually anemic. And if you look at those age 15 to 24, 1/3, even more, 1/3 of our adolescents are actually anemic. The rate of overweight and obesity among adolescents is also alarming. We can see that there has been a significant increase in terms of overweight of adolescents starting from 93 to 2014. So it has been increased very steeply from just about 5% to more than 15% in 2014. And we haven't got the recent data, but we already predict that the rate of overweight and obesity in adolescents will be much higher than you can see the data from 2014. So what happened with that adolescent dietary intake? If you look at their nutritional status, then we wonder about how their dietary intake is. So if you look at the data here, this is from UNICEF Nutrition Baseline Survey back in 2017 that we did in 2 districts. We can see that only around half, even less than half of the adolescents actually have more than 5 food groups, which is actually the recommended dietary diversity of adolescent boys and girls. And if you look at the daily consumption, only around less than 20% of adolescents who actually consume fruits and vegetables, and then eggs, and also green leafy vegetables, in daily basis. So this is the picture of the adolescent nutrition intake. This is data that we got in 2017, and recently we also did our digital nutrition survey on adolescent nutrition during the pandemic, and we see the high increase of the unhealthy food, which is including the sweetened beverages and fast food. So this is actually has been pictured way before the pandemic happened, that our adolescents are actually consuming fruits less than once a day per month. So you can see here about 1/3 of adolescents were not consuming fruits on a daily basis. Only around 20% of adolescents were actually consuming vegetables on daily basis, and overall, less than half of the adolescents were consuming fruits more than twice a day. Fast food is increasingly popular among adolescents. More than half of the adolescents consuming fast food at least once a day. So it can be more when we say that it is at least once a day. And more than 1/4 of adolescents consume carbonated drink at least also once a day. So how about physical activity? We can see here that there has been a significant decrease of physical activities among adolescents. So if we look at those who are actually doing vigorous physical activity, you can see that there's a steady rate among them. These are the adolescents who actually have a very good awareness of doing physical activity. But if you look at those who are actually doing moderate physical activity, and even one very popular physical activity, which is walking, you can see a significant drop from the year of 2007 to 2014. on the percentage of adolescents actually do moderate physical activity and also performed walking in the last a few years. So why it is important to invest in adolescent nutrition? Adolescents constitute half of the world's future human capital. So this is an enormous asset for the country for economic and social progress. So as you know that in Indonesia, adolescent actually is about 1/5 of the total population. So it is actually very important to make sure that our adolescents actually have a good nutritional status and also healthy. And this is a very well-known nutrition and a life cycle diagram. So we know that adolescent growth, especially those who are malnourished, will grow into pregnant women who are also malnourished and have a higher risk of giving birth of low birth weight babies. And in turn, they're going to grow into also children with a higher risk of becoming stunted. So this vicious cycle will keep happening if no intervention is actually done at any point, including the first 1,000 days and also during the adolescence period. So also, Indonesia is unlikely to meet the SDGs and global nutrition targets without investing in programs that reach adolescents. And most importantly, actually, adolescence period is the second life cycle window of opportunity. As we know, there is during the adolescence period, they experience growth spurt. So what is the goal of adolescent nutrition in Indonesia? When we started the program back in 2016, we have two goals. Adolescent nutrition being mainstream into relevant health sector plans, strategies, and policy, and adolescent nutrition program guidance is available to support scale-up at subnational and also national levels. So we implemented a modeling into district with a phased approach. So we started the modeling with a series of baseline studies back in 2016 and 2017. And then we also did a series of consultations with multi-sectoral government ministries and also offices back at the national and subnational level, and also many other stakeholders, including academics and CSO, to design the program in 2017. And then the year after, we started with the development of the learning package, setting and pre-testing the intervention strategies, and we implement the gender-responsive intervention package for in-school adolescents in 2019-2020, in which the American Fund was the implementing partner for the program. So the program itself, then well known as Aksi Bergizi, this is now has been launched into a national movement. And the Aksi Bergizi program consists of 3 components. So the first one is weekly iron folic acid supplementation for adolescent growth. The second component, nutrition education. And the third component is social behavior change communication. So there are 5 different program strategies, which is actually included under the health system strengthening. The first one is advocacy for policies at the national as well as subnational level. We also doing community mobilization as well as school mobilization. Coordination of multi-sectoral government, this is very important and I will explain why. And then monitoring and evaluation both from the national, province and district level, and also capacity building of all these stakeholders. So let me start with the first component. This is weekly iron folic acid supplementation, or what we call WIFs. The national guideline of WIF is actually already available back in 2016. So when we started the program, there already a national program of weekly iron folic acid supplementation for adolescent girls, but they are suffering from low coverage and compliance. So we would like to strengthen the program at school, and we encourage the districts to establish IFA Day, and also ask the school to actually allocate 45 minutes every once a week. So the protocol of the program is we ask the school to ask the students, both boys and girls, to bring breakfast from home. And then girls consume IFA at school, and then weekly learning session of Aksi Bergizi. So actually 45 minutes consisting of breakfast, weekly iron folic acid supplementation, and also nutrition education. We developed the SOP for weekly iron folic acid supplementation. We did capacity building of the service providers, including the teachers and also the health workers, to make sure that the program can be implemented at school. And we developed solid monitoring and evaluation system for WIF of adolescent growth. So the second component, which is actually done at the same day with WIFs and breakfast, is nutrition education. This is where the name of Aksi actually started, because the name of Aksi actually the name of the nutrition education materials, which consisting of 8 topics. So it's not only talking about nutrition for adolescents, because when you talk to adolescents and you talk about nutrition and ask them to actually eat fruits and vegetables, maybe none of them will be interested. So we also complement the nutrition education with the topic which is of interest to the adolescents, which include reproductive health, HIV and AIDS, addictive substances, violence and injuries. We also talk about mental health, including bullying, sanitation and personal hygiene, including management of menstrual hygiene, and also prevention of non-communicable disease. So all of these topics are actually delivered in an interactive manner, fun and class-based activities for high school students, which are delivered by the teachers and also sometimes also delivered by the student themselves. So the student actually learn about nutrition and other topics, health topic, which is of interest to them in a fun way. So it's not like one-way teaching style, but they do it through playing games. They do it through discussions. They doing role play with their friends at school, and they're having fun. So this has been quite a great success, as we receive a very positive response from the adolescent, a very high demand from many districts and provinces. So the third component is social behavior change communication. So when we talk about social behavior change communication, we actually try to also address and also include the people around the adolescent themselves. So this is what we call socio-ecological model, which actually showing how the behavior of individual, here are the adolescents, of course, are actually influenced by the people around them, which include the families, friends, social network, include their community, include their organization. So here are the schools, the community around them, and also policy, which surround them, and also becoming the enabling environment. So when we do social behavior change communication, what we do are actually the school mobilization activities at the school level. So we ask the students to be the leader of many activities at the school level. So they conduct cooking competition, healthy breakfast photo, healthy canteen movement. They do physical activity with parents. They do anemia events with parents. And they also disseminate key messages on nutrition through social media and mass media, and also through the events that they created at school. So after many years, actually, we implemented the program. The full component of the program actually started at the end of 2018. So by 2019, the 3 component has been completed, and the Aksi Bergizi actually evaluated at the end of 2020. We did a longitudinal study among 30 schools in Klaten district and 30 schools in Lombok district. And we did a baseline and end-line evaluation, so baseline before the implementation of the intervention, of the full package of the intervention, and end-line after the full package of intervention. Just for the information, the end-line evaluation actually has been conducted during the pandemic. So that time we're actually quite pessimistic, yeah, because we thought that the results will show us quite a failure, because the school has been closed actually since March 2020. And the end line itself was actually conducted in November 2020, when the students are actually learning from home. But we're very proud to share with you that the good behavior actually remained after the student received Aksi Bergizi program. So there has been a significant increase in the nutrition knowledge of adolescents. there has been a significant increase of adolescent girls who consume weekly iron folic acid, and also a significant increase on this consumption of fruits and vegetables, and also the performance of physical activity 60 minutes every day, and the reduction of unhealthy food here, including the sweetened beverages. So the results of the Aksi and line evaluation has been published in paper Nutrient, which was published this year, and I included the link here if you are interested to read about the evaluation of the program. So the program then scaled up to national level. With that evidence and the advocacy that has been conducted, the program then scaled up to national level under what we call School Health Program, or the UKS program, which has been actually shared by the previous speaker. So there are three pillars of triad of the School Health Program. So the first one is nutrition health services, which is, of course, when we talk about nutrition, is translated into nutrition services. And the second triad is health education, which is translated into nutrition education when we talk about nutrition. And then the third one is healthy school environment. So this triad actually needs to be supported by a good management of the school health program. So the school health program triad has been written into technical guideline back in 2021 and is published by the Ministry of Health, which actually provide guidance for the district, province, and also schools to implement the school health program. So when we look at the guideline, what actually consisting of nutrition services for adolescents? So of course, the first one is weekly iron folic acid supplementation. The second one is screening of nutritional status, including the screening on anemia and also treatment of anemia. And the third one is school feeding program. Nutrition education consisting of weekly nutrition education, also literacy of nutrition, optimization of physical activity, which can be done through the physical education lessons, and also extracurricular, which include many activities which can be considered physical activity, even dancing, and also other sports at school, and also capacity building of adolescent champions. And this is very important because this is a program for adolescents, and we cannot do program for adolescents without actually involving them and making sure that they are actually at the front of the program. And the third component, or the third triad of the school health program, is healthy school food environment, which is establishing of healthy school canteen and also school gardening to ensure there's a sustainability, and also making sure that the result of the school's gardening or the harvest can actually be used as well for a school feeding program. So what is the strategy for program implementation that Aksi Bergizi had, and actually also has been scaled up at the national level? So there is capacity building at all levels. So this is what has been conducted actually during the pilot, and now actually has been also conducted nationally. We are doing a cascade training for the district facilitators of school health program managers and also health workers, who in turn are going to provide a capacity building for teachers, and teachers deliver the program to the students, but teachers also responsible to actually provide capacity building for the students at school. So there is multi-sectoral coordination, and this is very important because when we talk about adolescent nutrition and adolescent health, this is actually the program which coming from the health sector. But the schools that actually belongs to two other ministries, which is the Ministry of Education and Ministry of Religious Affairs, in the case of Indonesia, because we have religious schools. So the schools themselves, the district education offices and the religious offices, which have to be involved in making sure that they have the ownership of the program, in addition, of course, to the health facilities, district and province health offices. So we also include community here, which can be the people around the schools, the village community volunteers, the adolescents themselves, the parents, TSO, and also academics. And we also include the provincial and district government, the planning agency, and also the government which is representing the Ministry of Home Affairs. So this is some of the workshop that we conducted for the program design actually, but it has been actually involved multi-sectoral government at the province and district level. And this is during the first launching of Aksi Bergizi by the Minister of Health back in 2020, just before the pandemic. And you can see here the people actually standing there coming from different ministries, in addition to the Minister of Health himself and also the DG. So as mentioned, involvement of adolescent is very important, yeah. So we cannot design a program without involving them. So right from the beginning, the program actually has been co-created with adolescents. And we also do capacity building of adolescents to make sure that they can be peer support for their friends at schools, they can be champions at school, they are the one who actually lead the community mobilization or the school mobilization, and also deliver key messages on nutrition. So adolescent is a very important subject for this program, and they not only the object of the program, of course, they have to be the champions, they have to be the agent of change. So we also do a lot of advocacy for the program at sub-national level, both at the province and district level. And this is what we did during the pilots of the program. And even during the pilot of the program, there has been a lot of decree already issued by the district government and the provincial government to support Aksi Bergizi. So these are the decree that actually has been issued back in 2018 and 2019 during the pilot of the program. So we have received very good commitment from the subnational government even during the pilot. And we also implement a supportive supervision, which is actually done through joint monitoring of multi-sectoral government. So again, the one who actually visits schools, the one who actually monitor the program is not only the health sector, but they need to come also from the education sector and also the religious affairs office, because the schools actually also, the school activity is very much related with the district education office and religious office in the case of religious schools. So there are also monitoring and evaluation meetings, which is done online and offline, and that has been done many times before the pandemic, and even during the pandemic, when the pilot is already completed, we implement a lot of monitoring and evaluation meetings with the ministries and also the province and district government. There has been this application which is developed by the Ministry of Health for a self-reporting of weekly iron folic acid supplementation for adolescent girls. So this program called Ceria, which mean in Bahasa prevention of anemia among adolescents, yeah, is going to be launched at the end of the month, yeah, by the Ministry of Health and also other ministries, and this is going to be started to be used nationwide by the adolescent girls, and this is going to be linked with the nutrition surveillance system of the Ministry of Health called CGC. So which means that the Puskesmas and also district health office can pull the data from this Ceria application, and that can be linked to the dashboard for the reporting of weekly iron folic acid supplementation. So this actually going to address many bottlenecks in terms of layer of monitoring system from the school level, in which nowadays the school will have to fill out many forms to show the coverage and compliance of weekly iron folic acid supplementation. Now the students are actually required to just fill out the application, and then the school can use also the application to know or to explore their coverage at the school level, and then the Puskesmas and district health office can also pull the data, and then that can be reported to the national level. So that's going to ease a lot of process and also address a lot of bottleneck at the field level. So when we talk about the national scale up, there has been national policy and government commitment, which actually issued by the ministries. So last year, we supported the Ministry of Education to develop the national guideline on nutrition program for junior high school. So this has been used actually by the Ministry of Education, especially the Directorate of Junior High School, to implement the program and also to support capacity building of teachers all over the country on Aksi Bergizi program. And very recently, there has been commitment letters to implement Aksi Bergizi from the Ministry of Education and Ministry of Religious Affairs. And ultimately, there has been a joint ministerial decree of 4 ministries on Aksi Bergizi program, which is going to be launched during the National Health Day this year on the 26th of October. The National Health Day itself is actually 11th of November, but the event is going to be conducted at the 26th of November. So this is actually the ultimate achievement of Aksi Bergizi, having the support under the joint ministerial decree of 4 ministries, and to launch the Aksi Bergizi program as the national program of adolescent nutrition. So, but then when we ask about what does it mean by national scale up in terms of the implementations, so the program actually, even before the national launching, has been implemented by the 3 ministries: Ministry of Health, Ministry of Religious Affairs, and Ministry of Education under the School Health Program. And currently, there has been more than 150 districts in 2022 who has received capacity building and also being under the monitoring and evaluation system of the Ministry of Education, Ministry of Religious Affairs, and Ministry of Health. So as mentioned, the Aksi Bergizi is going to be launched by the government and national program and also national movement on adolescent nutrition, especially to promote iron folic acid supplementation, physical activity, and also nutrition education. So how UNICEF support the scaling up of the program? So the program actually, Aksi Bergizi, started with only a pilot in 2 districts back in 2018 until 2020. But then with the national scale up, we are actually supporting the 3 ministries to support the program in 34 provinces with the support from our field offices. Here we have 5 field offices in Indonesia. There is Banda Aceh office, Surabaya office, which covering East Java and Central Java. We have Kupang office covering the province of East Nusa Tenggara and West Nusa Tenggara. We have Makassar office covering the province of South Sulawesi and Jayapura office, which covering 2 provinces. So there has been significant support from the field office to the sub-district, to the sub-national government in implementing Aksi Bergizi. UNICEF support is actually catalytic. So if we talk about UNICEF support, it's actually a drop in the ocean compared to the resources from the ministries. So the ministries actually has been implemented a big portion of the program with their own resources. So in terms of advocacy, UNICEF supporting the national policy development, multi-sectoral coordination meeting, and also workshop. We also support awareness creation, especially among the adolescents. We conducted a lot of youth engagement events with the adolescents, both online and offline. We also supported the government for cascade training only at the national level. So the government has really implemented the training at the subnational level, and we also support the development of Sharia and also the monitoring and evaluation. So the field office of UNICEF actually supporting as well for the advocacy. So there has been supporting for the issuance of subnational policy, including the district regulation, governor decree, and also development of policy brief at the province and district level. They do on-the-job training. So we have implementing partners led by the field office of UNICEF, and this implementing partner actually provide support to the schools, and also they providing they try to also address the bottleneck with the schools and government at the subnational level face during the program implementation. And in terms of monitoring and evaluation, our field office also facilitate the joint monitoring workshop, meeting, and also data review at the province and district level. So here are the publication of Aksi Bergizi in our adolescent nutrition program. We have perhaps almost 20 publications at the moment. And this has been published in international peer-reviewed journal, in international magazines. Also, there are some publications in the form of policy brief, study reports, program guideline, training modules, We also document the policy practice and also the best practice. And also we have numerous videos and social media posts document the testimony from the field and also best practices from the adolescents themselves. So if you are interested, please go into this link below that I put in the slide. So thank you. I hand it over back to Mr. Tohir.
Okay, thank you, Mrs. Khairin. So, as Khairin said, that it is very important to invest in adolescents' health, and for that we need a strategy for program implementation that includes capacity building at all level, multi-sectoral coordination, like what mentioned previously by Mrs. Laila, and then advocacy for policy and government commitment, involvement of adolescents at all levels, such as Dr. Kecil that mentioned by Mrs. Laila, and also from the study of Mrs. Halda that found that the use of peer-to-peer approaches in health promotion and prevention targeting youth seems to be a strategy with a great potential for the SBNP program. And of course, then the implemented programs should be supported with the program monitoring and evaluation with a supportive supervision. So thank you once again, Mrs. Irene. So let's move on to the fourth speaker. But before we go to the next speaker, I would like to invite everyone and remind everyone that you can ask questions by filling out the Google form at the following at the link that has been shared in the chat box, either in Zoom and YouTube also. The link has been shared in the chat box, so please feel free to ask questions for the speakers. So let's go to the next speaker. Okay, our fourth speaker is then from the Ministry of Health Malaysia, Mrs. Siti Adiba binti Abdul Halim, MSc. So she is the Principal Assistant Director, Children and Adolescent Nutrition of Ministry of Health Malaysia. She has a Magister of Food Science from University Kebangsaan Malaysia and a Bachelor of Science from the University Kebangsaan Malaysia. She was a technical member in drafting the standard for follow-up formula Codex 156 1997. A writer of key message consume moderate amount of fish, meat, poultry, eggs, legumes, and nuts for Malaysian Dietary Guidelines 2020, and a writer of section of vitamin A in the recommended nutrition intakes for Malaysia 2017. So without further ado, with all due respect, please welcome Mrs. Siti Adiba.
Assalamualaikum. Can you hear me?
Yeah, so I can hear you, but not really clear. So
Can you hear me?
not yet clear. Is there any other committee? Can you clearly hear Mrs. Siti Adiba?
Okay, since I think everyone can hear me. Okay, Assalamualaikum and a very good morning. I wish to all and welcome to my presentation today. First and foremost, I would like to thank the organizers for inviting me here today. My name is Siti Adiba Abdul Halim, and I'm a nutritionist and in charge of children and adolescent nutrition in Nutrition Division, Ministry of Health Malaysia. Can you please differentiate share my slide? Thank you. Yes. My name is Adiba. What I'd like to share today is on the role of local government nutritionists in promoting healthy eating habits among school children in Malaysia. Okay. Nutritionists play a significant role in developing a healthy country through promoting nutritional well-being of the individual, as well as population to prevent and control any nutrition-related diseases at various target groups, including schools. The topic that I will given today is particular interest to
Mrs. Siti Adiba, I'm so sorry to cut you off, but I cannot hear you clearly. Maybe if you can without headphone, maybe you can.
So I'm sorry for that. Now it's much better. Can you hear my voice?
Yeah, it's like what is it?
How about this? Is it okay?
Yeah, Mr. Diva, I think your voice is a little bit muffled. It's not solid as it comes out of your microphone, so that's why it's not that clear. Well, anyway, is any other laptop with you or on this? I mean, tuned in this forum?
Okay, I try to.
There's an echo also, but nevertheless, just get close to the microphone and speak louder, and that will be fine, I believe so.
Okay, I'm sorry for the technical issue. How about this?
Okay, much better this time. Yeah.
Okay, maybe I have to repeat everything again.
Yeah. Okay. Thank you very much.
Sorry. Okay, Assalamualaikum and a very good morning to all. And welcome to my presentation today. First and foremost, I would like to thank the organizers for inviting me here. Today, my name is Siti Adiba. I'm a nutritionist and in charge of children and adolescent nutrition in Nutrition Division, Ministry of Health, Malaysia. What I'd like to share today is on the role of local government nutritionists in promoting healthy eating habits among school children in Malaysia. The nutritionists role in developing a healthy country through promoting nutritional well-being of the individual and as well as for the population to prevent and control nutrition-related diseases of various target groups at different settings, including schools. Okay, so my topic today is of particular interest to those who are policymakers, Ministry of Health, nutritionists from and other related agencies from other countries to learn and inspire each other towards creating a healthy young generation. Okay. So it will be useful to divide my talk into 4 sections. I'll begin or start off by looking at Malaysia in a glance. Then I move on to highlight on our current Malaysian National Nutrition Policy. And after that, we briefly go through the nutritional issues faced by school children in Malaysia. And after that, we'll be looking at the school-based nutrition programs in Malaysia, which will also cover on the roles of the government nutritionists. Next slide. Okay, Malaysia is, as you can see here, Malaysia is located in Southeast Asia, which is between Singapore, Thailand, and Indonesia. Malaysia is a multi-ethnic and multi-religious country. Malaysia's population is a mix of 3 major ethnic groups, each with its own heritage, culture, and tradition. And about 60% of the population are Bumi Putra, includes Malays, Orang Asli, and other indigenous people. And minorities are Chinese, Indians, and Malaysia has more than 150 regional languages. The official language is Bahasa Malaysia. Okay, now let's have a look at the current population estimates in Malaysia in 2022. The total population of Malaysia in 2022 is estimated at 32.7 million as compared to 32.6 million in 2021, with an annual population growth rate at 0.2%. The composition of to 14 years old, or as in category of young age in 2022 is about 23.2%. It brings almost a quarter of the Malaysian population is at the young age. The number is decreasing compared to the last 2 years. It is important to nourish this group to make sure that they have a fit and healthy life. They are the future of our generation, and their nutritional needs are critical for the well-being of the society.
I'm sorry, this is Siti Adiba. So your voice is still we hear it as has a tremble or something, so we cannot hear clearly. We cannot hear you clearly. So
Okay, can I use change the laptop first? Maybe it can improve the picture.
yeah, I'm sorry, we cannot still hear you clearly. So do you have any other other headphone maybe that you can use?
Ms. Adiba, are you using a laptop or a computer, a PC? Where is your sound coming from?
I'm using.
The one is clear.
I'm using my laptop.
Oh yeah, that is much clearer now. It's solid voice coming out right now.
How about this? Is it okay?
Yes.
Yeah. Yes. Yeah.
I'm so sorry for that interruption. So should we go back to earlier slide or just
continue on with this slide right now? Thank you very much.
Okay. Okay, next slide, please. Okay, this is the National Nutrition Policy of Malaysia 2.0 that has been launched in 2021 as a continuous effort of Malaysia to combat the problem of malnutrition in the country. The National Nutrition Policy of Malaysia is determined to achieve, enhance, and maintain the well-being of the population. The policy aims to evaluate the nutritional status of the population, reduce diet-related non-communicable disease, and strengthen food and nutrition society. Okay, this new policy outlines a 13th strategy to ensure the well-being of the population is achieved and maintained through nutrition. And one of the missions is by reducing the double burden of malnutrition in the population. Okay, this is the milestone of the NPAN, National Nutrition Policy and NPAN, which has been started since 1992. NPAN is a short form for the National Plan of Action for Nutrition in Malaysia. It is a framework to address food and nutrition challenges in the country. It is the national blueprint to promote optimal nutritional well-being of Malaysians through a series of strategies and activities. There is a phase of policy revolution from time to time in order to make sure that the strategy is relevant, updating based on the international commitment and the current nutrition problem or issues faced in the country. Next. Okay, now we have a look at the nutritional issues of school children. As you can see here, children in Malaysia are having double burden of malnutrition, and malnutrition refers to deficiency or excessive in nutrient intake and imbalance of essential nutrients. They are having undernutrition, which is thinness, and micronutrient deficiency, which is anemia, and also obesity. Undernutrition affects how children grow and is associated with impact cognitive functions. And it's also affect the school absenteeism and poor school cognitive performance. Okay, from the National Survey data in 2019, it shows that nutritional deficiency anemia is a common problem within a woman, within a reproductive age woman, which is 15 to 49 years old in Malaysia. Anemia can cause children to be tired and weak and hampering their ability to pay attention in class. And from this data, it shows that Malaysian children are not having an appropriate diet. Inappropriate diet intakes during this time generally can continues into adult life and can span generations. Okay, from this is shows the slide shows dietary habits and dietary intakes of the children and adolescents in Malaysia. Okay, from the slide, it shows that 70% of the school children skip breakfast regularly, 50% skip lunch, and 50% skip their dinner. Okay, so irregular meal patterns were significantly associated with lower micronutrient intakes. When the student is hungry, learning become more difficult. Okay, moreover, 2 in 3 adolescents ate inadequate fruits daily, which is less than 2 servings a day, and 75% of adolescents ate inadequate vegetables daily. And it also happens for milk and milk product food intake, whereby 3 in 4 adolescents did not take the product based on the daily recommendations. Okay, and it is much more worrying. 1 in 3 students had carbonated soft drinks at least once daily. So persistent efforts must be continued to promote and inculcate healthy eating habits among children from an early stage, as the habit is high tendency to be continuous into adult life. Okay. Okay, from the data that I have presented to you earlier, it shows that there is an urgent need to improve school children health and habits as soon as possible. School-based nutrition programs need to be introduced in preschool, primary and secondary school, as age of 5 to 17 years old provide a second window of opportunity. During this period, children could make up for gross deficit suffered earlier. Okay, and this is where and why nutritionists are needed to play their roles and functions through nutrition interventions, research, and policy development in the country. Okay, this is roles of nutritionists. Nutritionist is an individual who is trained and registered as a nutritionist to promote nutritional well-being of the individuals and population, as well as to prevent and control nutrition-related diseases of various target group at different setting and level. Okay, this is included in school. Nutritionists, in terms of regulate policies and regulations, nutritionists are needed to provide input for the development and implementation of the policies, action plan, and intervention based on the current nutrition issues. And nutritionists also undertake capacity building in nutrition through education and training, and provide technical advices and consultations in nutrition-related matters, and assess, monitor, and evaluate nutritional status of community and population group, and so on. Okay, next. Okay, I have break the activities down into setting. Starts off with preschool. Okay, here is list of nutrition promotions in preschool. We've been working together closely with Ministry of Health, Ministry of Education Malaysia, Ministry of Rural Development, and receive a tremendous support from them. And these activities are nutrition promotion, which is involved of parents in nutrition education activities in preschool. And we also conduct plain water drinking campaign. And we also have kitchen garden, currently carried out in Kemas Kindergarten, which is known as Pintar Botani. And we also integrate a nutrition component in curriculum, and also do a nutritional consultancy, such as development of standard menus in the preschool. Next. Okay, in primary school, we continue doing the development, implementation, and evaluation of nutrition promotion program, while we expanding school feeding program known as HITS. Okay, HITS is a voluntary school feeding program that serves package of nutritious meals for school children during recess time. Nutritionists also do a monitoring of the sales of foods and drinks at the school canteen based on healthy school canteen guidelines that was produced by Ministry of Education Malaysia. And the guidelines prohibit the sales of unhealthy foods and drinks in the school canteen, such as ultra-processed food. Okay. However, the school coverage is, in terms of monitoring, the school coverage is limited due to the lack of manpower. The total of a school in Malaysia is about 10,200, while the number of nutritionists is only just almost about 500 people. Okay, we also do a monitoring on the wholly government-funded school feeding program, which is known as RMT, or Supplementary Feeding Program. RMT is a program that gives out food based on eligibility to hardcore poor children. And nutritionists also do the monitoring of micronutrient status, such as determining iodine status in school children as the vulnerable target group in the USI gazetted area. Okay, and then we also provide technical advice on consultation in nutrition related matters in school, such as school milk program, and we also help in development of healthy canteen guidelines, and also help in terms of menus. Okay, and school milk program is a program that delivers a box of milk. It is a UHT plain milk, which is to be taken daily, about 200 ml to the children based on their eligibility. And milk should be consumed at schools, and it's under the supervisions of the teachers. Okay, next. Okay, this is what I've been mentioned earlier about one of our program is on school feeding programs known as Hidangan Berkhasiat di Sekolah, and it's called HITS. Okay, HITS is an initiative to educate on healthy eating at school. HITS serve package of nutritious meal consists of carbohydrate, protein sources, vegetables, fruit, and plain water. It is given during recess time, and the menu was planned by the nutritionist by taking into account about 18 to 25% of the calorie needs of the school children. And HITS aim to ensure the school children receive nutritious meal according to their nutritional requirement based on the recommended nutrient intake. And in addition, this program increased knowledge and inculcate healthy eating habits among the school children, as well as providing a supportive environment towards healthy eating at school. Okay, and HITS relies on private funds, usually from parents, and parents must pay a fee to enroll their children in the program. and the fee is made bi-weekly or monthly based on based as what has been decided by the PTAs, Parent Teachers Association, schools, administrator, and the canteen operators itself. And the payment is paid directly to the canteen owner to reduce any possibility of financial abusement. Okay, and for the time being, HITS has been implemented voluntarily throughout the country. And our future direction is to implement HITS in all schools via HUT policy, as HITS can improve the nutritional status of the children as it provide a controlled environment to support healthy eating among school children. And the benefit of HITS is go far beyond the health and education, making it a high return investment in our children. Okay, next. Okay, the activities continues to the secondary school and on top of that, in secondary school, we cater the nutrition service in boarding school, whereby we develop the standard menus for the school, for the student based on their RNI or recommended nutrient intake. And in order to make sure that the preparation of the menus is accordance to the guidelines, nutritionists are obliged to monitor the conformity of the menu. And the government Malaysia is providing 3 main meals and 2 snacks for children at the boarding school. Okay. Okay, that's all for me. Sharing from Malaysia about the roles of nutritionists, the government nutritionists in school. Thank you.
Okay, thank you, Ms. Adiba. So yeah, as Ms. Adiba mentioned, there is a many program that has been implemented in Malaysia for the better nutrition of the children, and also that about the role of the nutritionist in Malaysia that include the promotion and prevention of the nutrition through policy and regulation, education, training, assessment and monitoring of nutritional status, carrying out nutrition interventions, consultation, and research development. However, as despite the lack of nutritionists that is available in the country, that is also happen in Indonesia and also maybe in other Southeast Asia countries. We hope that the improvement of nutrition status could be improved further. So let's go to the next speaker. Our next speaker is from Philippines. It's Mr. Raul Capistrano, PhD. So he is from the Bureau of Curriculum Development of the Department of Education, Central Office of Philippines. So he has earned his Doctor of Philosophy major in International Hospitality Management in 2021. He finished his master's degrees in Hugo Amang Rodriguez Institute of Science and Technology in 2016. He completed his bachelor degree at New Era University in 2011, and he passed the board exam for teachers in March 2012. Dr. Capistrano is a product of technical course at Quezon National Agricultural School. He finished food preparation and service technology and was granted the Medal of High Honors in 2006. So he started serving the academy in 2017, teaching culinary arts and other related hospitality and tourism subjects in different colleges and universities in Metro Manila. He entered public school in 2014 as teacher at Maligaya High School and Master Teacher 1 in 2016 at Lagro High School, Senior High School. He serves as the TVL coordinator who trains and mentor teachers. So he has many experience regarding this. So without further ado, with all due respect, please welcome Dr. Capistrano.
Yeah, good morning. Thank you very much, sir. Allow me to share my screen. Please acknowledge if my screen is already presented for.
Yes, we can see your screen.
So once again, good morning, everyone. On behalf of the Department of Education, please accept my sincerest thanks to the Southeast Asian Ministers of Education Organization, the Regional Center for Food and Nutrition, for inviting us to participate in this great endeavor, the Regional School-Based Nutrition Promotion Forum. So I am here to present the topic about the improving the health and nutrition lifestyles of Filipino learners through curriculum. Once again, I am Mr. Roel A. Capiscano. My presentation will revolve around the following: the policies and programs of the Department of Education that supports the health and nutrition. Second one is the Philippine Basic Education curriculum on the context of health and nutrition and our ways forward. Allow me to share some of the initiatives of our department. When we talk about the policy, the Department of Education released the policy guidelines on healthy food and beverage choices in school and offices. So it aims to make available healthier food and beverages choices among learners and DepEd personnel and stakeholders. This policy also provides a system of categorizing locally available foods and drinks in accordance with geographical, cultural, religious orientations. At the same time, it provides guidance in evaluating and categorizing food and drinks at the same, and also the selling and marketing of food and beverages at the same time, the purchasing of foods for school feeding. So this policy ensures that canteens in schools and offices shall not sell foods and beverages that high in fats or sugar and sodium. Further, it gives clearer guidance to the school canteens on what to provide not only to the learners, but also to the teaching and non-teaching personnel. Through this policy, the Pinggang Pinoy on your screen, or the healthy food plate, was strengthened. So this is a plate-based food guide for all stages. So this is a simple and familiar image associated with eating that provides immediate visual cues about portion size on a per meal basis. Moreover, it informs consumers how to build a healthy and balanced meal. At the same time, it guides everyone to drink a lot of water and less sugary beverage products. When we talk about programs, the department established supporting our learners in the school-based feeding program. So it aims to address hunger and encourage learners to enroll. This is to contribute to the improvement of their nutritional status, provide nourishment for their growth and development, help boost their immune system, and enhance and improve their health and nutritional values. As such, this program provides the beneficiaries with nutritious food products and also milk supplement. So this program supported by other government agencies, local agencies, and also the non-government organizations. In connection with the feeding program that we have in our department, through DepEd Memorandum, the Gulayan sa Paaralan, or vegetable gardening, was established. So wherein it encouraged both public, elementary, and secondary schools to have a school gardens to ensure a continuous supply of vegetables for food consumptions for the beneficiaries. So the harvested vegetables here are prepared, then cooked and served to the learners. And also, As regards to this, there are researches, local researches, that the nutrition or nutritional status of our learners are improved. We also conduct the celebration of Nutrition Month. This is an annual campaign held every July to create a greater awareness among Filipinos on the importance of nutrition as provided by the Presidential Decree 491 or the Nutrition Act of the Philippines. NEPED enjoins the all learners, and including the teaching and non-teaching personnel, officials, and other stakeholders, including the parents, to participate in these activities related to the Nutrition Month celebration. So in school, the TLE teachers gave or conduct activities that promote the importance of nutrition and having a healthy lifestyle, such as slogans, poster making contests, cooking contests, at the same time healthy food bazaar. So as regards to the K to 12 curriculum, how the curriculum contributes to the improvement of the health and nutrition lifestyles of our learners. In the curriculum in the curriculum for technology and livelihood education, as you can see on the screen, beginning in grade 4, students are taught on how to assist their elders in preparing nutritious foods. The concept of food groups and the food pyramid were also introduced to them in grades 5 and 6. So these competencies are intensified, including the basic food preservation. At key stage 3 to senior high school, one of the specializations that we offer in TVL is focusing on caregiving. So the competencies here are focused on the nutritional needs of infants and toddlers, children by age level, um, and cultural practices, dietary requirements, and also the nutritional value of foods. In the Philippine Basic Curriculum, we ensure that the introduction of prerequisite skills or competencies are integrated with other learning areas. These are some learning areas that we ensure the integration of nutrition and health in the curriculum. So we have here the kindergarten curriculum. So we have a domain here, or focusing on the domain for physical health and motor development. So children are expected to develop both their fine and gross motor skills to be efficient and effective movers when engaging in wholesome physical and health activities. Hence, they are also expected to acquire an understanding of good health habits and develop their awareness about the importance of safety and how they can prevent danger at home, in school, and in public places. On your screen is the conceptual framework of health education under music, arts, health, and physical education subject. So one of the contents here is nutrition. So which addresses the importance of eating healthy and establishing good eating habits, especially for children and adolescents, as a way to enhance health and prevent diseases. So to further strengthen the aim of the framework, the key stage standards here require learners to demonstrate an understanding and observance in healthy habits and practices in achieving wellness. That's for grades 1 to 3. While in key stage 2, that's for grades 4 to 6, learners demonstrate an understanding of how changes, which are part of growth and development, the impact of health practices that help achieve and sustain optimum health and wellness. And for key stage 3, grade 7 to 10, the learners here demonstrate an understanding of key concepts related to health to achieve, to sustain, and promote wellness, at the same time improves the quality of life of the individual, the family, and the larger community. At the onset of revising the K-12 curriculum, the Bureau of Curriculum Development ensures that the competencies related to health and nutrition are given similar weight, because this is the way that we can teach our learners how a healthy diet promotes better academic performances. That is why the Department of Education makes certain in improving health and nutrition lifestyles of our learners. At the same time, not only in TLE, or technology and livelihood education, but also across with other learning areas, bundled with strong policies and programs. Likewise, we ensuring the capacity of our learners, rather our teachers, by providing them with the training and workshops related to health and nutrition. Lastly, we have to invest in health and nutrition to have a better quality education. Once again, maraming salamat po. Thank you very much.
Thank you very much, Dr. Capistrano. So, yeah, I agree with you. We have to invest in health and nutrition to have a better quality education. So, it is very interesting that the Philippines, Department of Education is about to develop integrated curriculum that introduce nutrition for the children. So, I think it is very interesting to know that how will the government coordinate among each other to result in the integrated curriculum. But let's hold it for later. So, we will. So there's we have already have 5 our speakers, and so let's continue to the next session. So the next session is about a Q&A session for the speaker. So I think we have already several questions for the speaker. Can the commentary show question? Okay, so for the first question, this is the question for Wihalda Husun. So the question is from Medina Rizkita from Semi Kita and Science. So the first one is based on the conclusion of the review, behavior change framework is necessary to enforce nutrition for Western learning. So is there any of the research included behavior change framework to their study, and how did they do it, and what is the result? And also, she also want you to explain more about the peer-to-peer approaches in health promotion intervention. Which kind of peer-to-peer approach that should be used, and how can they explain which behavior can improve the health promotion intervention? So for Mrs. Halda, Dr. Halda.
Okay, thank you, Ms. Medina, for the question. I was just checking the studies. Yes, they have. They did. They use the some behavior change framework, like the social cognitive theory. That's among other, yeah, the social cognitive theory mostly used in the studies. And they use the framework to develop the intervention, as well as basically to develop the intervention. I think that what they did for the research. Tohir, sorry, can I see the question again?
Okay, Commander, can you?
Okay. I forget the second question actually.
Let's go to So the second question is about the
which one is that?
sorry.
Okay. Okay. Yeah. So the results shows that the use of the behavior change framework for the study, as mentioned, is also it improved the knowledge and knowledge and attitude, but the involvement of the additional component, not only information dissemination, should enhance the result of the study. What I mean is that the behavior framework, the behavior change communication is one thing, but the implementation, I mean the strengthening of other component in the environment, as well as the strengthening of the capacity building of parents also play a role in the result of the study. And then the second is, can you explain more about the peer-to-peer approaches in health promotion intervention? Yes, peer-to-peer approaches is like, for example, in the presentation mentioned by Dr. Irene and also by Ibu Laila, they have like making duta, the nutrition champion at school, yeah. And this nutrition champion is actually students, peer who can be the agent to promote a healthier lifestyle to their peers. The what kind of peer-to-peer approach? The one which is conducted, as far as I know, is having some nutrition champion who will become jadi like duta gizi, who will become the one who are delivering messages to the peers. I think that's I think that was the answer, my answer to the question. I hope.
Yeah, thank you, Wahelda. So this is the answer from Wahelda. So let's move on to the second question. Committee, is it the second question? Okay, so the second question is also for Wahelda soon. This is from Asila from Senior Sesar.
Okay. 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 Yes. Indeed, from this study, we know that involvement of all stakeholders is important, and it is actually also mentioned by Ibu Laila and Dr. Irene when mentioned about the specific program of Aksi Bergizi. Yeah, involvement of stakeholders includes the involvement of the school policy, school community, including the head principal, and also including the principal, and then teachers, and then school canteen operator. So the involvement of all stakeholders is important. That is at the school level. At the broader level, like in the local government, so all stakeholders involved to deliver nutrition education in school is important. Like the involvement of Dinas Kesehatan, the district health office, and then the district education office. They need to have a more collaboration, and that was also the finding from the study. Each stakeholders have their roles, of course. Yeah, each stakeholders have their roles, and then I think the roles of each stakeholders is inherent to the duty of to their duty. Like for example, at the local level, if we want to strengthen the anemia prevention, the roles of the district health office is by providing the iron pill supplement, and then also doing nutrition coming to the school during the routinely, and then also conducting nutrition education at school in a specific time. And for the school, for the Dinas Pendidikan, for example, of course the policy to support teachers to conduct the nutrition education at school is important. Because teacher will be willing to do the nutrition education if there is incentive to do that at school. So coordination and collaboration between line ministries or at the local level is also important. And apart from the coordination of all stakeholders at school, I think that's right.
Yeah. So the involvement and roles of the stakeholder is actually based on their inherent data.
Yeah.
But they're not much different from what they usually do. Sure.
Yes, I think so.
Okay, thank you, Behalda. So let's move on to the third question. Okay, so this is the third question from Mrs. Dwi Nastiti from Smartphone for our speaker, Ms. Aida Rosita. So the question is, national scaling up of the school nutrition program is a unique challenge. Based on UNICEF experience, what are your suggestions in terms of the advocacy action needed to be taken by the SBNP working group to enhance the scaling up nutrition program in Indonesia? Mrs. Irene. Okay, I think Mrs. Irene
probably not yet. Yeah.
Yeah, probably it's not connected yet. So we will move on. We will ask again later after she coming with us. So we will move to the next question. Okay, this question is for Mrs. Laila from the Ministry of Education, Culture, Business and Republic of Indonesia, from Dr. Kaudian from the Department of Basic Education, Ministry of Education, Myanmar. So, how to allocate the finance for nutrition education program, and which ministry is leading in your country? So for Mrs. Laila, please.
Yeah, thanks for the question, Dr. Cho from Myanmar. So related to programs and budget at a school level, the Ministry of Education in Indonesia, together with the Ministry of Finance and local governments, in providing funding for school. We call it Bantuan Operasional Sekolah, or BOS, or in English is School Operational Assistance. There are 10 components of using the fund for elementary school level, and nutrition education can be included in the components of maintaining school facilities and infrastructure, also in implementing learning and extracurricular activities, because as I explained earlier, the Healthy School program can be implemented either through intracurricular, co-curricular, or extracurricular activities. I also like to inform you in Indonesia we call it rapor pendidikan, school, identify their weakness and allocate the budget according to the problems. And related to the budget at the central government, we collaborate with the Ministry of Planning and Development and the Ministry of Finance to plan the budget for a healthy school program. We also advocate for local governments to allocate budget for healthy school program intervention. Yeah, I think that's my answer, Tahir.
Okay, thank you, Mrs. Faira. So I think we have Mrs. Irene with us.
Hello, yes, thank
Yeah,
you, Pak Thohir.
yeah, we can go back to the previous question. So yeah, so Ms. Irene, so this is a question from Dwi from Simmerek One, but based on UNICEF experience, what are your suggestions in terms of the advocacy action need to be taken by the school-based nutrition promotion working group Indonesia to enhance the scaling up nutrition program in Indonesia?
Yeah, thank you, Pak Thohir, for the question, and thank you for Dr. Dwi Nastiti for the question. I think this is a very valid question. Yeah, how the advocacy can actually be implemented or be performed by many stakeholders to actually improve the national program of school health program or nutrition-based program in a school-based program in Indonesia for both school children and adolescents. So yes, I think while the program itself actually now has been scaled up at the national level, there are a lot of program strengthening that needs to be done. One of them is actually the strengthening of the food environment or the healthy school food environment, which need to be in place as well to make sure that the obesogenic environment is actually addressed by many stakeholders. So this is going to include, for instance, the regulation of marketing of unhealthy food at the school level, the establishment of school canteen, the awareness of the parents and community on the food environment, and also the involvement and also the monitoring and evaluation of the program itself. So I think at the regional level, we believe that many best practices can be shared by the respective countries for the improvement of the program. And I think we can share on what has been conducted well in other countries. For instance, I think in terms of school feeding, in terms of the school canteen, in terms of establishing food environments, and we can provide that evidence to the governments to strengthen the program, the implementation of the program itself. Since I think CIMIO institution or CIMIO or the regional network for the school-based nutrition program is actually very much academic in nature, I think one possible advocacy can be done through providing evidence of many programs which has been implemented through research and studies in Southeast Asian regions. And I think that is also very important because I'm sure many governments, not only Indonesia, but also many Southeast Asian countries has been scaling up the program based on a very solid evidence of successfulness of the program or effectiveness of the program to develop policies, to issue regulation, and to issue technical guidelines to guide program implementation at the field level. So I think a very solid evidence need to be produced from research and also from documentation of best practices of programs that has been implemented well in many countries. So I think that's two examples on how the regional network can actually contribute to the program strengthening of the nutrition program for school children and adolescents. Back to you, Pak Thohir.
Okay, thank you, Ms. Irene. So that's the answer from Mr. Irene. Hopefully it can answer your question. So we will go to the next question. And the question is for Siti Adiba, come from Belinda Beltram from Department of Education, the Philippines. So may I ask what is the ratio of higher nutrition to learners to effectively implement school nutrition programs? So for Ms. Adiba. Ms. Adiba, are you with us?
Okay, can you hear me?
Yeah, you can read.
Okay, back to the question, what is the ratio of higher nutrition needs to learners to effectively implement school nutrition programs? Okay, for the time being, in Malaysia, we do not have a designated nutritionist to which is specific to a school nutrition to school, which is all nutritionists, government nutritionists are placed in Jabatan Kesihatan Negeri or district health district level, which is they have to use they have to practice their nutrition, the practice and to advocate on nutrition to all from home to tomb, which is also includes the school setting. We try our best to fulfill nutritionist ratio to population that is in a ratio of 1 nutritionist per 10,000 population in the country in order to get a healthier children and adolescents in the country.
Okay. Thank you, Ms. Adiba. So it's not to learn compared to learners, but still compared to the population. So the number of the nutritions.
Yeah.
Okay. So okay. So we will move to the next question. Yeah, so the question is for all speakers. I think every speaker could answer this. So the question is from Sir Luhanain Abdulhab from Simyosan. The question is about most ministries have very good policies being implemented to ensure canteens serve healthy food, and congratulations from him. And what about the approach to avoid school children to buy junk food or unhealthy food right outside the school gate? In personal experience, there are many mobile hawkers selling carbonated drinks and processed food with high amount of calorie or seasoning, and then the temptation in that for the children. So I think we can start from Dr. Abistrano for the answer.
Yeah, thank you very much. In the Philippine setup, we have this kind of support given by the local government unit to avoid or to limit the selling of the junk foods or the processed food outside or selling outside of the schools. At the same time, there's our schools rules or regulations avoiding or preventing bringing food from outside or from the store, and except for those foods or these foods prepared at home. So that's the support given by the local government unit, at the same time the school management or the school administration.
Okay. So in the Philippines, it is the policy is forbid anyone to buy food in front of the gate of school, right? Dr. Shah? Yeah. Okay. So maybe next is from Ms. Adiba.
Okay. Okay, for Malaysia, for the time being, we have a guidelines, which is it outlines all the which is inhibits the selling of junk food, unhealthy food, includes carbonated drinks and processed food. The guideline is we inhibit the selling with a perimeter 40 meters from the school compound, it is under the purview of the local authorities, and it is under the undang-undang kecil ataupun under the undang-undang kecil. And for the time being, all the school and teachers have to make sure that their school compound within 40 meters from the school compound did not sell the junk food or any unhealthy food, this is to be in line with the same guidelines that has been implemented in school canteen, which is in school canteen we have school canteen guidelines, which is also banning in the form of selling that food.
Okay, thank you very much, Ms. Adiba. So let's move to the answer of Mrs. Laila.
Yeah, that's good question, I think. This is the reason why the Ministry of Education launched Healthy School campaign, where one of the point is healthy nutrition. We conduct online and offline campaign. For online campaign, we use social media, and you can see in our Directorate of Primary School Instagram or in website, you can see that we campaigning this issue as a major issue that need to be addressed. And for online campaign, we conduct workshop for advocating school and local government. We also provide booklet or guideline for school that can be accessed in our website. I will send it in chat box. We have 2 websites that provide more information or guideline about healthy nutrient. Also, this is the first website. Another website is this one. Back to you, Tahir.
Okay, thank you, Ms. Laila. That is the website that you can get information from what is the government of Indonesia done to improve nutrition of the children, school age children. So, but yeah, it is in Indonesia, but if it's for our Indonesian friend, you can access the information there. So next, let's see our answer. The answer from the UNICEF from Mrs. Irene.
Thank you, Dr. Fir, for the questions. That is why actually at the moment I'm also with the Ministry of Health, because currently the Ministry of Health is also implementing posting media briefing for the launching of the program of the adolescent nutrition.
Ms. Irene, I'm sorry, your voice is not clear.
Okay, can you hear me now?
Yeah, it's choppy. It's choppy, I think.
Can you hear me? Is it clear now?
Still not, unfortunately.
Okay, let me check the internet connection.
I think this one just now that when you say internet connection, it's better. So,
Okay. Yes. So then maybe there's the internet dropping off at the moment. Okay. So yeah, I'm sorry that actually I'm having global Zoom at the moment because the Ministry of Health is also hosting a media event briefing for the adolescent nutrition program launching, which is going to be conducted on Wednesday. So yes, I think the question here, most ministries have very good policies being implemented to ensure canteen service healthy food. Congratulations. What about the approaches to avoid school children? Okay, so unfortunately for Indonesia, actually, even though there has been many guidelines, national guidelines for school canteen, we don't have a comprehensive guideline or integrated guideline on school canteen, which actually also restrict the sale of the unhealthy food. Yeah. So even inside the school canteen itself, even inside the school gate, let alone talking about the sale of the unhealthy food outside of the school gate. So I think this is quite still a homework for Indonesia to also have an integrated guideline to make sure that there is this collaboration between different stakeholders actually to work on this. And UNICEF is currently developing the guideline together with the Ministry of Health and Ministry of Religious Affairs and Ministry of Education to ensure that we have one harmonized guideline for school canteen. So in regard to making sure that there is the sale of unhealthy food outside of the school gate, this is including, actually this will need many approaches. The first one is the actually awareness generation to ensure that there is an understanding of the stakeholders and also including the private sectors and also the street vendors on the importance of providing healthy food, and this will need awareness generation and also capacity building. But also there's need to be a strong regulations, not only at the government side, but also at the school level to ensure that they regulate the sale of unhealthy food outside of the school premises. And this is very important because the government regulation might not be able to reach out to these street vendors right away, yeah. But there's need to be an understanding from or a regulation from the district and the school level. And again, to ensure that the school actually issue regulation at for the school premises, it will need awareness generation from for the school management. And this has been identified as lacking as well in the case of Indonesia, because when we did the study of the school canteen back in 2018-2019, we identified that actually many school management, including the school principals, are actually quite confused about the healthy canteen regulation because different ministries actually issues different regulation. So this is something that we can work also in terms of making sure that there is adequate capacity building for the school management and also awareness generation for the school management and also the stakeholders at the district level. Over to you, Tohir, Pak Tohir.
Thank you, Ms. Irene. So basically the school also should have a strong regulation about this. So not only the government, but also the school that also regulate about the school hawkers, mobile hawkers that selling on right outside the school. So let's also hear from Dr. Helga.
Okay, thank you, Tohir. So to wrap up, Mr. Zulkarnain and everybody, to wrap up, so indeed the mobile hawker selling, mobile hawker around school is a big problem, not only in Indonesia, but probably in many Southeast Asian countries. So from the answer from all the speakers, there is to approach, we need to work on the demand approach as well as on the supply side. Yeah. In the demand side, we need to have more awareness creation from at multiple level, not only among the students but also school management and also policymaker. And then also on the supply side, the regulation need to be in place, which is in many situations lacking, is lacking actually. So I think that's the once we have this demand and supply side coordinated and approach to demand and supply side, we hope that we can we can have a better food practices for the student. But also on the demand side and the supply side, also we need to see food environment at a bigger scope, because not only it is what food is available, but what food is seeing through advertisement, through food promotion, is also stick in the mind of the children. So also regulation in food marketing and also food advertisement is very important in terms of reducing unhealthy food consumption. I think that is Tohir. Thank you.
Yeah, thank you, Dr. Helder. So I think this is the last question for everyone. So before we close the session, I would like to thank you everyone, every speaker, for their insight regarding the SBNP implementation of the app scope, and hopefully what we learned today can help us in our respective countries, especially to develop better program and better implementation, and also better monitoring and evaluation for the nutrition, the balanced practice nutrition of our children. As mentioned before by our speaker, that the investment of the children nutrition is very important for the future of our generation. So thank you once again for all participants, and also for all the speakers. So for others, there is actually some other question, but for the other question, it will be answered. The answer will be given written, is due to the time constraint. So for the other question, will be answered written later in the YouTube. So thank you everyone for joining us today. So before we close the session, I would like to give back to the our MC.
Thank you very much for moderating the session, Mr. Ahmad Tohir. Our sincerest gratitude to our speakers, as well for the enlightening discussions and presentations. So for those who have raised their questions, as mentioned previously by Mr. Tohir, but haven't been answered, the questions will be forwarded to the speakers and the answers will be provided then on our YouTube channel. So make sure to access our live stream on Simeo Recfon's YouTube channel. Ladies and gentlemen, we are now privileged to have among us Dr. Kamal Leswaran Jaya Raja as a Program Officer for Research Evaluation, who will give his remarks on behalf of Director of Simeo Secretariat. Without further ado, please welcome Dr. Kamal. The time is yours.
Thank you, Miss. Thank you so much. To the Honorable Director, presenters, participants, Secretariat of SBNP Learning Exchange Forum, observers and guests, a very warm greetings from the CMU Secretariat. It has been an honor to be at the first regional school-based nutrition promotion learning exchange forum. And today we have certainly gained massively in sharing policies, programs, strategies, and the best practices of SBNP program implementation, particularly on building healthy and nutritious eating habits among the school children and adolescents in Southeast Asia. For our perspective, for CMU's perspective, we always believe that our successes and challenges must be discussed in depth, particularly on how we can strengthen and deepen our mandates, which includes meaningful forums such as this. This forum has given us an opportunity to forge new partnerships and solidify the old ones. Together, we must focus towards achieving our goal in providing inclusive and equitable quality education and lifelong learning opportunities in the region as the leading regional organization in education, science, and culture. SBNP platform is a regional knowledge management platform for school-based nutrition promotion in Southeast Asia, which was number 1, well created, number 2, well managed, and number 3, hosted successfully by Simeo Rekfon and other stakeholders. We believe that this regional learning exchange forum supports Simeo priority areas number 2 on addressing barriers to inclusive education and number 5 on revitalizing teacher education. We need to listen and learn from one another. So we did no need to start from zero, rather see on how we can adapt existing SBNP policies, programs, and best practices on our respective education settings. We also must appreciate the significant contribution of Simeo Rekfon in raising the awareness of school communities on the importance of improving the nutrition status of children and adolescents at the school setting through its Nutrition Goes to School NGTS program since its implementation started in year 2017. Ladies and gentlemen, fellow presenters, our road ahead will be full of challenges. We know that life is not a bed of roses, but let us be reminded of the future gains and lessons that we will learn as continuously improve as an organization as a whole. At our core, it is best to reach the unreached. We always hope that we can reach the unreached and provide a better quality for life for every Southeast Asian citizen. So with this, on behalf of Dr. Ethel, Simeo Director, I would sincerely love to thank the organizers and all the presenters, participants for your unwavering support. And of course, having me here today. Thank you so much for that. We here at Simeo Secretariat will continue to support Simeo Rekfon to achieve our vision and mission for the region. So thank you very much once again and congratulations. Thank you.
Thank you very much for your time and remarks, Dr. Kamal. So as we are getting closer to the end of our agenda, we will now kindly invite Simeo Rekfon's Deputy Director for Program, Dr. Jesus C. Fernandez, who will give his closing remarks and wrapping up today's session. Dr. Jess, please take over the session. Thank you. Pak Jess, I think you're still on mute.
That okay. So can you hear me now?
Yes, Pak, clearly.
Okay. First of all, I would like to thank Dr. Kamal for delivering the message on behalf of Dr. Ethel and the Senior Secretariat in general. So it's my privilege again to be with you to provide you the closing remarks and as well as giving some highlights of what we have heard from the speakers. I'm also really happy to hear all the progress that has been reported by the speakers. And on behalf of our center, as well as the Southeast Asian SBNP working group, I would like to really appreciate our speakers, our distinguished speakers who have shared with us the current policies and programs related to promoting nutrition among school children and adolescents in their respective countries. It is apparent from the presentations, ladies and gentlemen, that various forms of malnutrition exist among our school children and adolescents in varying degrees. However, it is also pleasing to know that these governments where the speakers come from have different health and nutrition literacy campaigns that are addressing this problem of our children, particularly in Indonesia, Malaysia, and the Philippines, in varying extent and through various sectors. This clearly indicates how government really puts importance on creating awareness to school children and adolescents to acquire proper health and nutrition habits for their own well-being towards their adulthood. Though there have been already some successes in implementing school-based nutrition promotion programs and activities in these countries, we have learned from the speaker's presentation, nevertheless, that there is no single approach to effectively address the health and nutritional needs of our school children and adolescents. What is needed is a package of appropriate interventions which requires good collaboration among government institutions as well as relevant organizations, especially so the members of the school communities, particularly the students themselves and their parents, to be able to bring about better outcomes. Certainly, these interventions require good individual and group communication strategies, as well as sustained efforts and commitments from all the concerned sectors. Of course, all efforts to promote school-based nutrition programs would require adequate budget and a functional monitoring and evaluation mechanism. This is the very reason why, ladies and gentlemen, our center initiated the establishment of the Southeast Asian-based school-based nutrition promotion group, working group, to strengthen the communities of practice in this aspect, to advocate more health and nutrition interventions at the school levels in our region. We believe that there is still much to be done. Like Dr. Kamal said, we don't have to start from zero, but we take note of what have been done and the best practices that we already have at the moment to improve our school-based nutrition promotion and ensure healthy future generations. Ladies and gentlemen, tomorrow we will be having our third workshop of the SBNP working group, which will aim to formulate plans of actions on SBNP for the next 3 years for the region. And certainly the insights from this forum will be incorporated during the discussion as our working group members will formulate the action plans. Once again, our heartfelt congratulations and appreciations to all the speakers for rendering a very insightful presentation this morning. And the same appreciation goes to our audience for their time to join the forum and also the active participation during the Q&A session. At this point, and on behalf of our director, it is my honor to officially close this forum. We hope to see you again a year from now for the next forum. Thank you very much and have a nice day. Back to you, Batita.
Thank you very much, Pak Jess, for the closing remarks and wrapping up the session. Now, this marks the end of our webinar and allow us to thank all our distinguished resource persons and honorable participants for your kind attention today. Also, thank you for everyone on YouTube who have joined us live stream as well. And I would like to inform you again that all participants are expected to fill in the evaluation form as a proof of attendance. And presentation materials can be accessed through links shared by the committee in the chat box and YouTube comment section. Once again, please allow yourself some time to fill in the evaluation form as a proof of attendance, because only those who completed the evaluation form are eligible to receive certificates of participation. We would like to remind the audience again that there will be other agendas for SBNP working group members tomorrow. The morning session will be the workshop on CE SBNP working group, and will continue with the workshop on Indonesian SBNP working group in the afternoon. We would like to also invite you to subscribe to our YouTube channel, Simeo Rakfon. And also don't forget to check on our SBNP platform website on sbnp.simeo-rakfon.org for more information. Ladies and gentlemen, it's been a great pleasure for me to be the master of ceremony on this regional learning exchange on school-based nutrition promotion. I'm Nindita. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, everyone.
Fast towards your goal, live life with full of hope. Together we'll make it happen. Nutrition goes to school, 'cause we are the agents of change. And higher be the greatest. We are the agents of change. 'Cause we're the awesome generation. To dream of a better future. We need a healthy present. Good nutrition we must nurture. To build an active world. Breakfast before you go. Make sure you please complete with food that can make you nourish. Run fast towards your goal. Live life with full of hope. Together we'll make it. Cause we're the awesome generation. To dream of a better future, we need a healthy present. Good nutrition we must nurture. To build an active world. Breakfast before you go. Make sure your plate's complete with food that can make you nourished. Run fast towards your goal. Live life with full of hope. Together we'll make it happen. Nutrition goes to school, 'cause we are the agents of change. And higher be the greatest. We are the agents of change. 'Cause we're the awesome generation. To dream of a better future. We need a healthy present. Good nutrition we must nurture. To build an active world. Breakfast before you go. Make sure you please complete with food that can make you nourished. Run fast towards your goal. Live life with full of hope. Together we'll make it happen. And GTS is the way. We are the agents of change. And higher be the greatest. We are the agents of change. 'Cause we're the awesome generation. To dream of a better future, we need a healthy present. Good nutrition we must nurture to build an active world. Breakfast before you go, make sure your plate's complete with food that can make you nourished. Run fast towards your goal, live life with full of hope. Together we'll make it happen. Nutrition nutrition goes to school. 'Cause we are the agents of change. And higher breathe the greatness. We are the agents of change. Cause we're the awesome generation to dream of a better future. We need a healthy present, good nutrition we must nurture to build an active world. Breakfast before you go, make sure your plate's complete with food that can make you nourished. Run fast towards your goal, live life with full of hope. Together we'll make it happen, and GTS is the way. We are the agents of change. And higher breathe the greatness. We are the agents of change. Yes, we're the awesome generation. Cause we're the awesome generation. To dream of a better future, we need a healthy present. Good nutrition we must nurture to build an active world. Breakfast before you go, make sure your plate's complete with food that can make you nourished. Run fast towards your goal, live life with full of hope. Together we'll make it happen, nutrition goes to school. 'Cause we are the agents of change. And higher breathe the greatness. We are the agents of change. Cause we're the awesome generation to dream of a better future. We need a healthy present, good nutrition we must nurture to build an active world. Breakfast before you go, make sure your plate's complete with food that can make you nourished. Run fast towards your goal, live life with full of hope. Together we'll make it happen, and GTS is the way. We are the agents of change. And higher breathe the greatness. We are the agents of change. Yes, we're the awesome generation. Cause we're the awesome generation.